All right, I think we are live. So, welcome everyone to the channel. As always, I'm Dr. Shan Hashmi. I'm a board certified nephrologist and obesity medicine specialist. And welcome back to our monthly Ask Me Anything or AMA sessions. Now, tonight we're going to cover several topics. We're going to start with the breakthrough discovery that can stop your kidney scarring before it even starts. And one of the things I get asked about all the time is the keto kidney debate. So we're going to settle that once and for all. Now, if you are watching, I'd love to know where are you watching from. I get comments from all across the world, and it would be fantastic to hear where everyone is from. So here's going to be our plan tonight. We're going to start with the two-test revolution. Essentially, why is it that your standard kidney test might actually be lying to you? Then I want to talk about these new kidney cell discoveries that just happened that can stop kidney disease at its source. Number 3, we're going to dive into metabolic drugs that protect both your kidney, your heart, and we're finding out more and more even your brain. Then we're going to get into the controversial topic, which is the truth about keto and your kidneys. And then finally, we're going to get into breakthrough treatments that have just been announced for rare kidney diseases. Lastly, we're going to go into a Q&A and answer all of the questions that you guys might have. So remember, these sessions are designed to give you the latest research that's happening right now, so you stay up to date. And then there's another Q&A that happens on the 4th Thursday of every month. That's for the channel members where it's just Q&A, so we can deep dive into all of your questions as well. So you get 2 live opportunities every single month. So what we're going to target and what's going to make this really, to me, a little bit special tonight is around the 20-minute mark. We're going to talk about this cell population that we've just discovered that appears after kidney injury. But what makes this really interesting is that now we're also finding out how to turn this off. And then later on in the video, we're going to talk about the exact things you need to know about ketogenic diets. When is it that they help the kidneys and when is it that they harm them? So let's dive into the topics and then we'll get into all of your questions and answers. So topic number 1, when the 2 most common kidney tests don't agree. So here's a question for everyone here. Have you ever been told your labs look fine, but you think to yourself, wait a second, something feels off? And the reason that can happen is because the traditional test, serum creatinine, it can be misleading. Here's an example. I saw a patient just last week. Their creatinine looked normal, but their Cystatin C told a completely different story. So when we talk about this, early kidney damage can occur and we can miss it for essentially years because we're just looking at creatinine. So here's why this becomes important, and here's what the science shows. There's a large international study. This was published in JAMA in 2025. It analyzed data from over 860,000 adults, and what they found was something very, very remarkable. When your Cystatin C shows significantly worse kidney function than your creatinine does, what you want to know in this situation we call discordance, when there's this discordance, your risk of kidney failure, heart disease, and death is substantially higher. How much higher? It's actually about 2 to 3 times higher. Once again, this is important to understand. When your Cystatin C and creatinine give very different results, the risk is 2 to 3 times higher for death. So let me explain to you why. Creatinine, we've talked about this before, creatinine comes from muscle. So when people have low muscle mass, older adults, women, people with chronic illness, they can look normal on paper even with significant kidney damage. Now, athletes are the opposite. They look abnormal on creatinine, but they're actually perfectly healthy. When you look at Cystatin C, Cystatin C is different because it comes from every cell in your body and is filtered only by the kidney. So in other words, it's less affected by diet or muscle mass, and it gives us a truer signal of filtration. So here's the key takeaway on this part. When the two tests disagree, believe the one that gives you the lower kidney function. So that worse kidney function result, if it's from cystatin C or if it's from creatinine, that's usually your real kidney function. And there are multiple studies that confirm this. So it turns out this discordance predicts outcomes better than either test alone. So for those of you guys watching, here's a question for all of you. Let me know in the comments if you've heard of cystatin C before. Type in yes. I'm really curious to find out from you. Or if this is the first time you're hearing this term, cystatin C, put no in the comments, because this is the kind of information that I want to make sure you understand, especially when it comes to different tests. All right, now let's get into the bottom line before we move on from this topic. And thank you for those guys replying yes. And it's good to know some of you haven't tested or known about this. So remember, the bottom line here is cystatin C can detect chronic kidney disease years earlier than creatinine alone. And this is especially important if you are over the age of 60, if you're a diabetic, if you have high blood pressure, if you have low muscle mass. So it's not that you need to just do one test only. My point tonight is that two tests are better than one. All right, let's get into topic number 2. This is really cool. This is about the new kidney cell discovery. So I look at this as this massive breakthrough that we really haven't been talking about, and I'm surprised it didn't get the attention that I was hoping that it would get. So kidney research in United Kingdom and the University of Edinburgh scientists, what they did was they used single cell RNA sequencing on injured kidney tissue. And what they found was a new cell population that only appears after the kidneys get hurt. In other words, they only appear in acute kidney injury, in chronic kidney disease. These cells were not there before the kidney damage. So you can think of these cells as emergency response cells that the kidney never uses unless the tissue is damaged. So they kind of show up like troublemakers at the scene of an accident. And here's what they do. These cells, they end up releasing pro-inflammatory signals. In other words, bad signals like TGF-beta, IL-6. And these signals, they fuel inflammation, they fuel fibrosis. Remember, fibrosis is just a fancy word for scarring. That's all it means. And so when you get this scar tissue, you can't filter blood. And remember, once your kidney scars, that function is gone. So keep in mind, when there's all sorts of gurus on the internet that are promising to reverse kidney disease and tell you all sorts of outlandish statistics like they completely cured somebody, that's not true. If you get scarring, if you get fibrosis at that level, we can't fix it. But if you have injury and inflammation, 100% we can get you better. So that distinction is very important because it's hope versus hype. On this channel, my commitment to you has always been hope, not any kind of outlandish hype. So let's come back to these molecules. So what they found was that there were two molecular switches. There was what they called the AP1 pathway, and then there were these senescence genes. And these two pathways, they control these cells. And what they found was when they blocked these switches in the lab and animal models, guess what happened to the scarring? The scarring dropped dramatically. So think about what this means. If we could potentially quiet the cells that get activated in kidney injury, we could potentially stop kidney disease progression altogether right after any acute kidney injury. Once again, this is huge because here's what most people don't know. An acute kidney injury is never minor. Even if your doctor says, look, your creatinine normalized, the problem is that the damage that occurred can linger. And so if you've ever had acute kidney injury, let me know in the comments below, because this is the kind of information you want to know about. This is the kind of research that's coming out that's giving us hope, not just hype. And so when we talk about targeting these exact cells, what's so beautiful about this is we're not just treating the whole kidney blindly like we have been. Kind of like what I'm talking about in the new series on IgA nephropathy, where we used to give just steroids across the board blanketly. We now have targeted therapies for IgA. Here's the same concept. We're no longer treating the whole kidney blindly, but we're targeting these trouble-making cells. This, my friends, is precision nephrology, and it's happening in our lifetime right now. All right, let me get a quick poll from you guys before we move on to treatments. Let me ask you, if you had a choice of choosing one breakthrough that we've covered to fast track into clinics tomorrow, what would you want? Would it be better diagnostic tests like Cystatin C that you would hope that your doctor would do? Or would you want these new therapies that are going to stop the scarring at the cellular level? So if you think diagnostic tests, pop a 1 in the chat. If you think these new novel pathways, put a 2 in there. I really want to see where you guys are and what you guys think should be the key thing that we should push for. All right, taking a pause up here, I see some of you guys are sending me your responses on different channels, and it looks like all of you guys are interested in the latest things, where the concept of prevention is the most important part when it comes to treating kidney disease rather than just having a diagnosis. So I'm glad to hear that, and I'm glad to hear all of you guys are thinking the right way. Now, let's talk about the drugs that are exactly doing that right now, the ones that are going to protect the kidneys before they scar. So these are what I call metabolic drugs that protect kidneys. And this is really the headline of 2024, 2025, and it's about to be 2026 headlines as well. The first one you've heard of many times is Semaglutide. I know some people say Semaglutide, doesn't matter. You can say Semaglutide, or if you're a cool kid like me, I'm kidding, it's a joke, you can say Semaglutide. Just like GLP-1s, I say GLP-1s, some people say GLP, nobody cares. So don't let that throw you over. So Semaglutide goes by the name, as you know, Ozempic or Wegovy. It's now FDA approved to reduce the risk of kidney progression, and it can lower the risk of cardiovascular death in type 2 diabetes with chronic kidney disease. Remember, I talked about this on this channel, that the approval came in January 2025, earlier this year. And it was based on the FLOW trial published in the New England Journal of Medicine. There were 3,533 participants across 28 countries. And what they saw was that Semaglutide, it reduced the endpoint of kidney failure or kidney function loss by about 24%, and also reduced the risk of cardiovascular death. And this is real change, real benefits that's available to you right now. And what's really important is, if you thought the price of these drugs is too much, you can't afford it, the good news is the price is going down. Then there's another drug, and this is called SGLT2 inhibitors. If you watch any of my videos, I talk about SGLT2 inhibitors over and over and over again. They are the standard of care. They remain cornerstones, and their names like Jardiance, Farxiga. The way they function is they lower the pressure in your kidneys. They reduce how much protein you're leaking. They cut the risk of heart failure hospitalizations by about 30%. And so here's what's happening right now. Clinicians, including me, we are starting to combine them. So we're combining Ozempic with empagliflozin or Jardiance together, because when you combine them, you're actually getting additive kidney protection, not just kidney protection, heart protection, kidney protection. What we're finding with drugs like Ozempic is there's also brain protection. I have really bad knees. I just recently had to stop doing jiu-jitsu because I tore my MCL on my right knee. I already tore it on my left knee, so I think my jiu-jitsu days are probably done with. But what's fascinating about SGLT2s is they have so much broad protection, and now GLP-1s are showing so many benefits, including things like osteoarthritis in the knees, Alzheimer's and dementia, and of course, kidney protection, helping with fatty liver, obstructive sleep apnea, MACE or cardiovascular death, and even the data is promising on heart failure. And that's why combining these two drugs is so important. And what's really neat about all of this news is you have cardiologists, heart doctors, you have kidney doctors or nephrologists, and you have endocrinologists. They're all aligned, and they're all starting to say the same thing, which is that these drugs, they're protecting multiple organs simultaneously. It's no longer the kidney doctor refuses to talk about the heart. It's that all of these work together. So let me make sure that you guys on the call tonight fully understands the mechanisms behind this. Remember, SGLT2 inhibitors, they let the kidney rest by reducing tubular stress on the kidneys. So they lower the workload. GLP-1 receptor agonists like Ozempic, Wegovy, they improve insulin sensitivity, they calm down inflammation, and they reduce oxidative stress. So different pathways, but the end point is the same. They protect the organ. And if any of you guys are already on GLP-1s like Ozempic, Wegovy, Zepbound, Mounjaro, Saxenda, just pop GLP-1 in the chat below. I'm really curious to see how many of you guys are on it. And then if any of you guys are on Jardiance or Farxiga or any of the SGLT2s, type it in there. The reason I'm bringing these names up and I'm asking you to type it because I want you to walk away and remember these names. Start to be an informed patient. No longer just wait for the doctor to say, you should do this or you should do that. No, you want to be able to go in with your questions, with your understanding of the names of these drugs and say, look, what about GLP-1? What about SGLT2? Should I be on it? So important things, because I want you to be knowledgeable. And this is fantastic, by the way. I see so many of you guys are already on these therapies. So this is absolutely wonderful. Okay, now, here's the thing you want to remember. A lot of people confuse these drugs as just treating sugar. There's so much more than that. Remember, we are not just treating sugar with these drugs. We are treating all sorts of different organs. And that's what makes it so cool. And yes, they cause weight loss, but these aren't just weight loss shots. These are multi-organ protective agents for heart, kidney, and brain. And that's why the difference comes in. Now, I want to be clear. These medications, they work best when you combine them with lifestyle changes. And this is where the self principle comes in. Remember, sleep, exercise, love, and food. Lifestyle is the engine. And these drugs are sort of the turbo boost. Can't have the turbo boost without the engine. You're gonna need both. So while we're talking about this, don't forget that you also want to think about the fact that in addition to their drugs, you still got to focus on the basics. The basics is what sets you up for success. Okay, now we're going to talk about the controversial topic. And I know this is controversial and you guys are going to be like, oh my God. But remember, what I always try to do is to give you the data. My job is not to tell you my opinion, right? This is where I think, once again, a lot of experts on the internet, I think they get it wrong. They're too much about opinion. But what people are looking for, once again, is not hype, is not clickbait so that somebody will watch your video. It's the real truth. And I truly believe if you go in with the right mentality, the right heart, and the right mindset of truly helping people, people will come. You will build something absolutely phenomenal. So this is the topic I promised I would talk about later. So here we go. The keto kidney everlasting debate, and this one's controversial. So what we know and what I've talked about from so many studies is high animal protein ketogenic diets, they raise the acid load and stress the kidneys. And especially in advanced kidney disease, is that clinically supervised, plant-dominant, ketogenic approaches can actually reduce inflammation and insulin resistance. So let me clarify what a plant-dominant keto means. What we're referring to here is we're talking about avocados, nuts, olive oil, tofu, non-starchy vegetables. What we're not talking about is bacon and butter. Okay, so take the bacon, take the butter out. We are talking more about plant-based healthy fats, and that's really the focus on it. So in studies that have been done, there are these studies that got published from Dr. Thomas Wimes' group, published in Cell Metabolism, and they were later published in other studies from 2023 to 2025. What they were able to show was that when it came to cyst growth in polycystic kidney disease, ketosis actually slowed down the growth of cysts. Oh, I'm so sorry, it's cutting out. All right, hopefully this sort of fixes it. I hope. Let me know if the live stream is coming back up. How about now, guys? Can you hear me now? Okay here? All right. Good, good, good. Okay. So let's keep going. So back to the ketosis part. In studies that were published, what they showed was that ketosis actually slowed down cyst growth in polycystic kidney disease models. So how is that possible? Because what happened was ketosis boosts something called autophagy. So autophagy is this cleaning of cells that are not working so good, and it lowers mTOR activity. So remember, mTOR is a growth pathway, and high mTOR makes cyst get larger and larger and larger. Ketones quiet mTOR. So, ultimate question, do ketones or a ketogenic diet protect the kidney? The answer is possibly, but under medical supervision. So here's the key part I want to make sure you guys understand. And it looks like there's some people having still some audio difficulties. I'm wondering what's happening on the stream front. And don't worry, this will be recorded and I'll repeat anything that's having a hard time. So don't worry if you miss anything. I'll make sure you get the information. But for people with advanced chronic kidney disease, what you want to know is if you have a kidney function less than 45, or people who have kidney stones, or they are dealing with metabolic acidosis, what you want to know in all of those cases is ketogenic diets are not recommended. But on the flip side, if you have early chronic kidney disease, if you have early polycystic kidney disease, if your acid-base balance is okay, and if you're under the guidance of a kidney doctor, you could try a plant-dominant ketogenic diet. But once again, just to make sure that everybody understood, if your kidney function is under 45, if you're forming kidney stones, if you're doing it unsupervised, or if you have acid or metabolic acidosis, don't do a ketogenic diet. Remember, the ketogenic diet I'm talking about is not bacon and butter. It's not all those saturated fats that are going to go and clog your blood vessels. It is healthy fats, and you can do that. But in advanced kidney disease, you want to minimize. So the bottom line with this one is keto isn't evil, but it's not a do-it-yourself kidney protocol either. You want to work with a dietitian. Okay, some of you guys, I know you had some audio difficulties, so keep in mind, all of the show notes are going to be available, and you can watch the replay of this. And Katie, I'm so sorry that you can't hear. I truly apologize. Everything looks good on my end, so I'm so sorry if you can't hear, but we'll be able to do it. And don't worry, just hang in there. Okay, for those of you guys who are on the call, if you've tried a ketogenic diet in the past, drop it in the comments below. And what type of ketogenic diet did you end up doing? Was it the healthy version, or was it the what I call the TikTok ketogenic diet, which is all filled with saturated fats and everything else? Pop it in the comments below. Let me see what you guys have been doing. And by the way, this is decaf coffee, and my daughter gave me this, which is the #1 dad cup. All right. And then while you're doing that, just keep in mind, the power of food is so amazing. And sometimes you'll hear people say that you can't do a keto diet, or you can't do low carb, or you can't do plant-based. This is not and this is not villainizing a diet. What I'm saying is when the evidence changes, I'm happy to come on and change my stance. But just keep in mind, we are not going for the TikTok keto. We're going for clinical, supervised, plant-forward keto. All right, now for some exciting stuff. The exciting stuff is really about rare kidney diseases. Kidney diseases that we don't really talk about as much. And this is going to be the final topic before we jump into all of your Q&A. And this is the one that gives me lots and lots and lots of hope. So here's what you want to know. For years, patients with IgA nephropathy, lupus nephritis, C3 glomerular nephropathy, they've heard the same thing. There's nothing we can do. But what precision medicine is doing now is changing that landscape. So let me give you some of the most amazing discoveries that have happened in 2025. So atacicept was published in the New England Journal of Medicine in 2025. It's a dual BAFF/APRIL blocker. Don't let the fancy words fool you. The bottom line with this atacicept is that in IgA nephropathy, it reduces protein in the urine by about 45%. That's incredible, absolutely incredible. And it slows the kidney function loss. Another thing that is so incredible, and that's not alone. And by the way, these names are really hard to pronounce, but if I butcher them, don't worry about it. The point is that these are things you can now talk to your doctor about. There's another drug, and it's called obinutuzumab. And obinutuzumab is for lupus nephritis. And what that shows is that there's better remission rates. Patients stayed better longer. Then there's another one. This is Fabhalta. Fabhalta is an oral complement inhibitor. It got approval in 2024 for IgA nephropathy. In 2025, it got approval for C3 glomerulopathy. And the reason this matters so much is because all of these things, lupus, IgA, C3, all of these things that we didn't have good treatment for, we now have terrific treatments coming out. And this is just the start. When we talk about things like AI is actually helping us to accelerate targets for new molecules, for new drugs to be formed. And that's why research is expanding faster than ever before. The ApoL1 inhibitors are also now being looked at for genetic kidney disease. So phase 2 data is showing significant protein reduction. So like I said, some of them are available now, others in late stage trials. But if, God forbid, you are dealing with these conditions, what I want you to know is this pace of discovery is accelerating. These drugs are targeting specific immune pathways, genetic pathways, instead of the blanket approach of just suppress your whole immune system. Suppressing the whole immune system has so many side effects, and that's the difference. The new approach is targeting the exact problem. The old approach was a shotgun approach. We would just throw everything at you. Didn't matter what the collateral damage was because we were just trying to control the disease. So what I want you to understand is if you are dealing with a rare kidney disease, please talk to your kidney doctor because we have so many new options that are available to all of you now. And this is exactly why I do this work, because once again, hope is evidence-based now. Today, we are starting to get so many things. So take a deep breath. We just went through an entire course on the latest research that's come up. Now I'm going to turn it over to you guys to get all of your questions answered. So pop your questions in the chat. There's some questions you guys already sent over to me. So let me go ahead and answer those while you're putting your questions in the chat. So question number 1. Should I get Cystatin C tested if my creatinine is normal? Excellent question. So what we were talking about on that topic was if you were over 60, you have diabetes, you have high blood pressure, or you have low muscle mass. Cystatin C could tell you kidney damage years before creatinine does. And so that was the JAMA study that I talked about at the beginning of today's AMA that was showing the difference in 2 tests, right? Creatinine versus Cystatin C. Another question you guys had asked was, are GLP-1s safe if I have chronic kidney disease stage 3? So the FLOW trial, it looked at patients with chronic kidney disease. Semaglutide goes by the name of Ozempic and Wegovy. It showed both kidney and heart benefits in that population. Now, everyone's situation is different. The key is medical supervision. So if you're on these medications, your nephrologist should be monitoring your kidney function regularly. One of the folks had asked, what about doing intermittent fasting instead of keto? So intermittent fasting and ketogenic diets, they work separately. In other words, the mechanisms are very different. Fasting cycles, what they do is they give your cells time to repair through autophagy. So once again, fasting, they let your cells have time to repair. ketogenic diets, they give your body basically ketones as a fuel source, so they reduce inflammation. The best approach really depends on your metabolism, your kidney, your health goals. Now, remember, even though I talked about the research on ketogenic diets, I still advocate a plant-predominant diet because the data on lower acid overall health is so much stronger with a plant-predominant diet. Now, people who have kidney disease in general, intermittent fasting is actually safer than strict keto, only because of the fact that you're not dealing with the acid load and so forth. So from that perspective, intermittent fasting makes more sense. All right, let me go all the way to the beginning of the chat. So one of the questions was, are NAD plus boosters safe? Well, the problem with NAD plus boosters, the challenge that we run into is the data on whether or not they do anything isn't that solid. Now, vitamin B3, which is niacin, is a precursor. There's some data that niacin can be effective, but niacin can cause all sorts of very difficult things. There's a lot of side effects to it. So the research on NAD and NAD precursors is early. I have some videos up. I'm constantly looking at the research from a longevity perspective, and as soon as I find good, credible research, I'll have it. Right now, though, I would not advise jumping on the bandwagon and spending your hard-earned money yet. If that changes, I'll come back to you guys. Let's see. Another question was, somebody said they have polycystic kidney disease. Is it all right to take Tylenol for flank pain? Yeah. Tylenol is perfectly safe in kidney disease. I know there's been all sorts of hoopla over Tylenol and autism. I'm going to share with you what the data shows in an upcoming video so you guys can all hear about it. But long story short is it is safe to be able to be used. I'm looking at some of the other questions here. Sorry, just scrolling through the questions. All right, what is the safe amount of creatine to take if you have chronic kidney disease? So remember, with creatine, most of the research has been done with 5 grams per day. Creatine does not harm the kidneys. It will make it look like your creatinine level is higher than it should be. Don't let that fool you. If you're going to go to your doctor, you got to make sure you stop taking creatine at least 2, 3, 4 days before you do the blood test because you need it to wash out of your system. Otherwise, it's going to make it look like your kidney disease is worse. And keep in mind, we use creatine in patients on dialysis because it can be very helpful in lowering cramps. And I was reading some of the other comments. So great. A lot of you guys, it looks like your doctors are on top of it. They're really giving you all sorts of very good advice. That's fantastic. What is the initials for the second test on lab order or results? It's CYS. I know my finger looks like weird, but CYS is the short version, but cystatin and the letter C. So sometimes you'll see it abbreviated as CIS-C. CIS-C. All right. Another question was, how would you know? I have 10% kidney scarring, so there's nothing I can do. The thing about scarring versus inflammation is if we give you the treatment and you start to see improvement in your kidney function, that's how we know. The only other way to find out is a kidney biopsy. The only way to know about damage is a kidney biopsy. One of the folks asked the question, stop my progression because tests help, but I want to live longer. Keep in mind, our goal is not just to live longer, it's to live better. And there's a big distinction in that because if you live longer, but you spend the last 10 years of your life in bed, that's not living. That really, to me, isn't. That's suffering. And we don't want you to suffer. And by the way, it's so amazing. We have people from New Zealand. That's phenomenal. All right, does semaglutide and SGLT2 help for IgA nephropathy? So you're going to see the entire video on IgA nephropathy. It's a 6-part series starting to be released on Tuesday. Remember, every Tuesday, Thursday, there are new videos. We're going to go through every part of it, but the short answer is yes. Somebody said Ozempic is dangerous. So Ozempic has lots of side effects, but once again, there isn't a drug out there that has 0 side effects. So everything is about an informed decision of risks and benefits and knowing how to minimize it. For example, the biggest side effect of Ozempic is nausea, vomiting, diarrhea. What are the things that make it so much worse? If you eat fried foods or if you eat simple sugars and you're on Ozempic, guess what? You're going to have lots and lots and lots of stomach issues. All right, somebody asked the question, I don't have high blood pressure or diabetes, but I do have kidney scarring, so Jardiance still work. Remember, Jardiance works in patients with chronic kidney disease, whether they're diabetic or they're not diabetic. It will still help. And so Lori asked the question, can I take these if I'm not a diabetic and not overweight? So Jardiance is the standard of care when it comes to kidney health. So the answer is we give Jardiance to patients regardless of whether they're diabetic or not. So does Jardiance really work? The evidence, there's so much evidence behind it, and you can read about it for yourself. Go to PubMed, and you can see all of the studies that are done. Look for reputable journals like the Journal of the American Medical Association, New England Journal of Medicine. These are very reputable journals. Cell is one that goes through the molecular pathways and, once again, very reputable. There are meta-analyses that are done. There's Cochrane reviews that are very prestigious. You can look at that. So once again, don't take my word or any person's word from the internet on these kind of things. Do your own research, and that's really, really important. And then I see a bunch of comments about in the middle, there was issues with the stream and there was lag and all sorts of stuff, so I'm so sorry. What if you weigh 100 with CKD3, heart problems, and hypertrophic cardiomyopathy and COPD? So remember, Laverne, these are very complex questions because if you have cardiomyopathy, we want to understand why it is. We want to figure out what is the changes that's going to happen. Do you need something like an SGLT2 specifically for kidney disease? So the answer is yes, we would use it for that. What about your heart problems? There's a bunch of different medicines that your heart doctor would make sure to give you. Let's see other questions on here. Sorry, mine was cutting out. We'll be on YouTube later. Fine. Bessa said carbs with whole grains in a daily base if bad for CKD? No. Carbs, the whole grain variety, are very healthy for you, and you can certainly do that. So once again, the data supports a plant predominant diet, and if you're doing that, that's okay. Is mustard bad for your kidneys? Not that I'm aware of. I have not heard anything like that. One person asked the question, number 6 said, how do you know if you have a rare kidney disease? Remember, the way we diagnose kidney disease is we have to do a kidney biopsy. So when you come to somebody like myself and you're looking for why you have protein in the urine, why you have blood in the urine, why the kidney function is going down, we'll do blood tests, we'll do urine tests, and oftentimes we need a kidney biopsy, not just for the diagnosis, but also to know the severity of the disease. So the answer is yes. Someone asked the question, is kidney biopsy necessary in stage 5? Well, oftentimes, if we take a picture of the kidneys and it looks like the kidneys have already shrunken, then we don't like to do a kidney biopsy because the risk of bleeding, the risk of complications is higher. So oftentimes in CKD 5 especially, we really don't do kidney biopsies there. And then let's see, I had a kidney biopsy, that's why I know 10% scarring, so got it. And why can't you take SGLT2 with PKD? No, we do take SGLT2s. If you didn't watch the series, there's an entire course on polycystic kidney disease and what are the treatments. One of those happens to be SGLT2s that we do use as far as that's concerned. Just keep in mind, there is a risk of infections that can occur with SGLT2s, and if you get a urinary tract infection and it goes into the cysts, it's much harder to get rid of the infection. So if you've probably heard, that's probably what it was about, was the whole concept of cysts. All right. Bessa said, I have consistent protein in the urine and blood in my urine test. Then we have to get it evaluated. We need to know, is it serious? What's the underlying cause? And more importantly, what's the treatment we're going to do? Somebody asked the question, with stage 5, is vitamin D2 1,250 micrograms capsules safe? It's a 12 count. So remember, when you're asking those specific questions, it's really hard for me to answer because I'm not your doctor, and none of this is a doctor-patient relationship, but this is general advice. We have to look at your blood work. What's your calcium like? Are we concerned that the high dose of vitamin D might cause your calcium to go up? And if your calcium gets too high, you could even go into acute kidney injury. And that's why we get concerned about it. Let's see. Do you prescribe GLP-1s for a BMI of 22.5 and a non-diabetic? No, we would not. Is a kidney ultrasound a good test to do? Yes. And that doesn't matter if you're CKD3A. If you come to me with chronic kidney disease, one of the things that I would always do is checking for an ultrasound, because I need to get a baseline of what I see on there. And there's a lot I can tell by an ultrasound. I don't need to do a CT and expose you to radiation. Ultrasound is a great starting test. Bessa said, I didn't do the biopsy because my kidneys are small. Yeah, so if your kidneys are small, Bessa, you're absolutely correct. Let's see, Warren asked the question, hi doc, 42-year-old male, serum creatinine stable, looks like it's good for 20 years. GFR is 75 to 80, Cystatin C is 95. Other lab test is perfect. Is further evaluation needed? No. So Warren, if you're not spilling protein in the urine, you don't have blood in the urine, then your kidney doctor is most likely going to say, look, there's nothing to worry about. Your primary care doctor is going to say there's nothing to worry about. And then let's see. Dove Club said, I have polycystic kidney disease and my doctor switched me from lisinopril to losartan. My renal dietitian has me taking supplements, NFR2 and Renadil. So I hear about kidney supplements a lot. And so let me just tell you a couple of things. First, probiotics have some evidence that they may be helpful. Some companies, they have branded them and they're charging a whole lot of money. So if you're thinking about it, just remember, bifidobacterium and lactobacillus can be bought over the counter. If you're someone like me who shops at Costco, if you're in the United States, you can get this stuff dirt cheap. So don't let a name fool you into thinking somehow it's miraculous because they said it's a kidney vitamin or it's a kidney, whatever it is, probiotic. It's just the basics. The vitamins are just B vitamins and a teeny tiny amount of C, and sometimes they'll put vitamin D and sometimes they'll put omega-3s in it. But you can do all of that by yourself. You don't need to spend an arm and a leg to go ahead and do that. So please don't let that fool you. Is it true that kidney transplant can't take probiotics? Once again, this is an individual thing where your doctor will talk to you about, because the worry there is will you be causing a change in the bacteria? Will that affect the absorption of your transplant medication? So this is where, not knowing your situation, you want to run it by your transplant doctor for sure. And then someone said, can enlarged prostate block circulation to the kidneys? Well, remember, an enlarged prostate can start to have fluid that normally the kidneys would send down to the bladder and out. So the fluid is backing up and it can cause something called hydronephrosis. And hydronephrosis can indeed, over time, damage the kidney. And if it's a complete obstruction, then that damage can occur very, very rapidly. All right. How helpful are sodium bicarbonate tablets. So remember, acid destroys the kidneys. A plant-based diet is an alkaline diet, and that's why it's so helpful to the kidneys. So if you do an alkaline diet, you're going to protect your kidneys. When we give sodium bicarbonate or baking soda, that's literally it. We're giving you alkaline environment. We're trying to get rid of the acid in your body. So sodium bicarbonate is just the sodium part that becomes an issue for our patients because that'll cause water retention, and that can lead to issues on your part. And then, is Pepcid Complete better than Tums? Well, it's a tough question to answer because Tums is calcium carbonate. You can certainly get way too much calcium in your body from Tums. That can cause calcifications. On the other hand, depends on what you're using it for. We sometimes use Tums to help bind phosphorus. The calcium carbonate will bind phosphorus in the gut. So in some cases, when people have low calcium in their body, we end up using Tums. Pepcid, on the other hand, is used more for acid reflux, and it can work right away, but it doesn't fix the underlying condition, right? If you're trying to reduce the acid, then we would use proton pump inhibitors, Prilosec, etc. But even those, you got to be mindful because those over time can damage the kidney. And does sugar destroy the kidneys? Well, this is the thing, right? If you have like fruit, doesn't do anything. It's actually very healthy for you because the sugar comes packaged with fiber and everything. It's very hard to go 100% sugar-free. I don't actually put anything in my coffee. What I do is it's coffee, and then I go to Costco, which is for those of you outside of the United States. It's like this big warehouse store, but I drink unflavored, unsweetened soy milk. And that's what I end up putting in here. So it ends up working great. So when I was young, I used to take things like stevia back in med school, and I had no idea how terrible stevia, monk fruit were. But now that I know, it's a different story. I stay away from those guys, and that's why it's just plain. And once again, it's decaf because I need to sleep at night. So does sugar damage the kidneys? Absolutely it does. But everything in moderation, and you don't want to be a purist over it. All right, let's take another one or two questions, and then we will call it a day and night so we can all return to our families. Let's see, is there a supplement to take that naturally stimulates EPO production? So remember, EPO, basically your bones get the signal from the kidneys that tells them to make blood, and that signal is erythropoietin. So unfortunately, when we don't have it, we don't have another way to do it. We have to give you EPO or things that act like EPOgen inside your body, because we have now drugs that instead of taking 3 injections a week, you can take them once a week, even some cases once a month. So technology has come a long ways. All right, what are are beets bad for kidneys in stage 5? So remember, beets are very high in potassium. And when you're at stage 5, potassium is a really big deal. Remember, what I tell people about potassium is to keep in mind that we individualize based on your blood tests. I never tell you don't have anything with high potassium. Can't have avocados, oranges, tomatoes, potatoes, melons, whatever. What I say is let's look at your blood work and then we'll make small adjustments to it. All right. Lastly, I just want to go ahead and thank you guys so much for supporting the channel. If you haven't joined the membership, consider it, please. It helps me to continue this work. If you already have, my deepest thanks to all of you for doing this. This was never about me trying to make any money. This was about me wanting to support you in your journey. When I was a kid, as you know, when I lost my sister to epilepsy, one of the things I wished was that there was a doctor who took an extra minute to care. And so my mission has always been to take an extra minute to care. I get hundreds of emails, sometimes thousands of comments. So if I don't respond to yours, please don't take it personally. One of the things I'm never allowed to do from my work is to do any consultations. The California Medical Board will not allow me to establish a doctor-patient relationship either. So please keep in mind that I can't be your doctor or do a consultation. It's not allowed. It's not because I don't want to. It's not allowed. And number 2 is I don't want you to feel like I do a consultation and you're expecting a miracle and things are going to change. You work so hard for your money. I want to do right by you because I'm also a father. I have 2 daughters and I love them to death. And I want to set the right example for them. So once again, my kindness, my gratitude to all of you for this journey, for supporting this channel. I look forward to seeing you guys again at the next AMA. But next up is all of the IgA nephropathy series. I have a video coming out on the latest on pig transplants, the kidney transplants. I'm just blown away by the research that's happening. Take care, stay happy, stay healthy, stay kind. I'll see you guys next time.